We have coronary heart disease, and we have heart failure. What that complication is seen as, we see a lot of patients who have left ventricular hypertrophy. How we can explain that? The heart is a muscle, and just like any muscle in your body, when you put it under stress, it reacts to the stress that you're submitting it to. For example, a guy who goes to the gym, starts out working at the gym, a few months afterwards, you find that he's big. Why? Because he's submitting his muscles under stress or pressure. The same thing happens to your heart. When you submit your heart to that high blood pressure, the heart has to force the blood at a high blood pressure, and in order to keep up with that, what it's going to do, it's going to become enlarged. The bad thing is, an enlarged heart or a large heart is a weak heart, and there's where we get heart failure from. In the eyes, we have retinopathy. In the peripheral vascular system, we have peripheral vascular disease, and the kidney, we have renal failure. These are some of the complications of high blood pressure. So that you can see it attacks all your target organs. That is why the onus is on us to make sure that we keep our blood pressure down. Reductions in sodium enhances response to antihypertensive drugs. What does that mean? You just reducing your intake of sodium, you will have a better response to your blood pressure medication. Your body responds better to your blood pressure medication. So lowering the extracellular volume by limiting sodium intake can enhance the response to most antihypertensive drugs. Dietary sodium restrictions or reduction makes the blood pressure more angiotensin II dependent, and therefore more responsive to therapy with an ACE inhibitor or angiotensin II receptor blocker. These are just some medication that we use to help lower your blood pressure. And we see that patients who are proteinuric. Proteinuric meaning that you're putting out protein in the urine. A person should not put protein out in your urine because you have a barrier, which is a filtration barrier. Anytime protein is about to pass, it prevents protein from coming out in the urine. So patients who have renal disease, one of the first signs that you can notice is that you have protein in your urine. And how you as an individual can know if you have protein in your urine, when you use the restroom, all of us, when we use the restroom, you will say froth. But the froth should dissipate or disappear as soon as you're finished. Now, if you want to know if you have protein in your urine, just go away for about 10-15 minutes and come back. If froth is still there after you've used the restroom, that means that it's protein that you're putting out. And that's a no-no sign, because it means that the kidneys are now under stress and the kidneys are now being affected by the high blood pressure or whatever factors, whatever is coming into play. But we're speaking about high blood pressure. Okay? Cardiovascular disease. This is also non-communicable disease. We see that cardiovascular disease is an umbrella term referring to stroke, coronary heart disease, and heart failure. And eating too much salt contributes to 2.3 million deaths from heart attack, stroke, and other cardiovascular diseases. Imagine that. And who is at risk most for cardiovascular disease? Older persons, persons with high blood pressure, persons who are diabetic, persons who are black or South Asian descent, and smokers are at an increased risk of having a stroke or heart attack. So, this is where we come under that umbrella. We're black. All right? So, we are at a higher risk of developing cardiovascular disease. Now, this is the World Health Organization. This is a list of the top 10 causes of death. And if you notice that what is heading the list is ischemic heart disease. Ischemic heart disease, 7.25 million deaths. We see also stroke and other cerebral vascular disease. So we see the great toll these diseases are having on society. That is why we have to nip it in the bud when it comes to management and control. Now, how does salt contribute to cardiovascular disease? Well, we see the risk of cardiovascular disease increases throughout the range of blood pressure starting from 115 over 75. Imagine that, because we are told that 120 over 80 is normal. So just starting from 115 over 75, we have an increase of cardiovascular disease, risk of cardiovascular disease. And again, salt is the major factor that increases blood pressure and is therefore responsible for the many strokes and heart attacks every year. Salt. It is estimated that if you reduce the salt, reduction of 6 grams of salt per day, it would reduce stroke by 24% and coronary heart disease by 18%. And this would prevent approximately 2.5 million strokes and coronary heart disease worldwide. Imagine, just limiting your consumption of salt can have such a profound effect on your health. Now, there's some trials that were done in persons, and it shows that, for example, we have the trial of hypertension prevention, which is TOHP 1 and 2. It's to show the effects of salt and salt consumption on cardiovascular disease. We see the long-term effects of salt reduction on cardiovascular disease is in more than 300 participants. So they had 300 persons who participated in this. And top 1 lasted 18 months, and 2 from 36 to 48 months. So we see here that individuals in the intervention group reduced their salt intake by 25 to 30%. So these persons just cut down on the amount of salt by 25 to 30%. And they saw a reduction in blood pressure by 1.7 in the systolic and 0.9 diastolic in top 1, and 1.2 over 0.7 in top 2. All right? So for example, if the patient had 120 over 80, they will have like a 119 over 80 over 79, for example. Okay? There was a lower in the blood pressure. And a follow-up study 10 to 15 years later showed that individuals who were originally allocated the reduced salt group had a 25% lower incidence of cardiovascular events. Again, just by lowering the amount of salt that you intake can have a profound effect on your health. The Harvard study, Harvard School as well also did one, and this was called INTERSALT, which stands for International Study of Electrolyte Excretion and Blood Pressure. We see that the researchers measured the amount of sodium excreted over a 24-hour period among more than 10,000 adults from 32 countries. And we see that the average was nearly 4,000 milligrams of sodium a day that persons excreted. And 200 milligrams a day among these persons are the Yanomamo people of Brazil, and 10,300 milligrams in northern Japan. So imagine, these Yanomamo persons are indigenous persons, Indians, and we see that their salt intake is so low that they only excreted 200 milligrams. Whereas in Japan, northern Japan, look at the amount of salt that those persons were excreting. 10,300 milligrams of salt in a day. So the greater the salt consumption, the higher the average blood pressure, and the greater the increase in blood pressure with the age. So the more salt you consume, the higher increase of your blood pressure. Coupled with that, if you're an older person, the higher the increase as well. And we see that 4 countries with salt intake under 1,300 milligrams per day had low average blood pressure and little or no upward trend of blood pressure with age. There was also a study that is called the DASH study. DASH study, dietary approaches to stop hypertension. So the first DASH trial, which was completed in 1997, half of the 459 participants were assigned to a diet that emphasized fruits, vegetables, low-fat dairy foods, and that limited red meat, saturated fats, and sweet. And the other half got a standard Western diet. What we saw, we said all the participants' meals were prepared by the DASH kitchen. After 8 weeks now, we saw that the DASH diet reduced systolic blood pressure by 11.4 millimeters of mercury, systolic, and the diastolic by 5.5. Imagine, just by watching what you eat, how the blood pressure was lowered. And the second trial looked at the impact of low sodium, the DASH diet. It worked even better. We see lower sodium reduced blood pressure, whether it was part of the usual US diet or the DASH diet. Okay? So, what are the health benefits that we can gain from reducing salt in our diet? We see that it reduces the risk of kidney disease, microalbuminuria, which is protein in the serum or protein in the blood, leaks from the kidney into the urine. So by reducing salt intake, if a person has protein in the urine, that can stop it by just reducing the salt. WASH studies, World Action on Salt and Health, published in the Journal of Hypertension. Salt may increase the growth and action of H. pylori. H. pylori is a bacteria that you can obtain from eating foods that are not washed properly, handled properly, like fruits and vegetables, drinking water that's contaminated. It's a bacteria that it lodges in the stomach. It loves an acid environment, and that is why it loves the stomach. It's a bacteria that can cause dyspeptic change. What is dyspeptic changes? Persons who have problems with their stomach, burning, pain, gas, bloating. It is also the bacteria that can lead to gastritis, and it can also lead to an ulcer. And as a complication, it can even lead to a cancerous lesion. Okay? So it's a bacteria that is very, very important that we know about it. And imagine, by just lowering salt, right, we can decrease the action of this bacteria in the stomach. And the Purdue University study published in the American Journal of Clinical Nutrition, it says that women lose calcium at an accelerated rate when they consume high salt diet. Again, women lose calcium at an accelerated rate when they consume a high salt diet. Okay, ladies who are worried about osteoporosis, brittle bones, and so forth, persons who consume high salt diet, they can lose calcium. Okay, so we see that by lowering the salt intake, you can decrease osteoporosis. Other health benefits of reducing salt: it decreases the severity of asthma. So persons who are asthmatic, by lowering their salt consumption, can help with asthma crisis. You won't have all that frequent asthma crisis. It also lowers the risk of stroke. It decreases blood pressure, reducing the need for blood pressure medication. And that is true, because we've had patients who are taking blood pressure medication. These persons decide, listen, I'm going to do a radical change when it comes to my diet, my lifestyle, and amazingly enough, many of these patients actually do come off of these blood pressure medication just by lowering the salt content. And we see that it also lowers the risk of heart disease, vascular and cardiac damage independent of high blood pressure. So, what are the source of sodium that we take? Where do we get the sodium from? We see that 5% of the sodium that we consume is added when we cook. So you add 5% to your food when you cook. Now, 77%, which is the biggest part of the pie chart, is obtained from processed foods. And when you go to restaurants, processed foods. So foods that are in a can, pickled foods, all these foods, they are very high in sodium. Okay? And we see that 12% becomes naturally in food, and 6% is added at the table, meaning that the salt shakers, 6%. So if you do not add salt to your food, and if you do not use salt at the table, 6 and 5, 11% you're taking me right there. Simple as that. Okay? And if you avoid processed foods, imagine 77%. The major part of the amount of sodium that you consume, it comes from processed foods. Salami, bologna, all these processed foods. Okay? So, what are some tips that we can use in order to reduce salt consumption? We start out from the supermarket or the grocery. When we are shopping, what are we going to do? We're going to buy fresh